Well, thank you, Dr. Osler. It's nice to be with you here, and also nice to be a part of this presentation that you are making. There is no doubt that periodontal disease and oral health itself is not only a major problem, but is also a very difficult problem for us to not only identify from a causative standpoint of view, but also it's very difficult for us to determine who is most susceptible. As clinicians, we have all known that periodontal disease is not only very frequently seen, but it's very difficult sometimes to treat effectively. One of my goals as a clinician has been to not only be a more effective therapist, but also to be a more effective diagnostician. As medicine has done, our profession now is moving into the molecular world. The molecular world is where physicians actually identify causation and where they identify genetic traits. Now, for the first time in the United States, we have a clinical laboratory that is designed for the medical problems that are associated in the oral cavity. Medical laboratory tests provide the way of communication to our staff, communication between ourselves, us, and also communication with our patients. It's very important that our patients understand the relationship between these bacterial infections and inflammation, and these tests that you can now provide for your patients give them a visual that they can use and that you can use to identify the causative agents of this very serious inflammatory disease. We also realize that physicians themselves communicate to their patients, and we are their patients. They communicate through laboratory reports. Now we have laboratory reports that, along with communicating with our patients and our staffs, we can also cross-communicate with our physicians. These laboratory reports are very easy to understand, and they help our physicians understand the disease that we are in fact diagnosing and treating. Without a doubt, dentistry and medicine are the same professions. We deal in different parts of our body itself, and yet we have the same objective, and that is to diagnose early and to treat early when our patients have the best chance of survival and, in fact, yes, even healing from disease states. Thus, I would congratulate Dr. Osler and his effort to broaden our scope so that we can have ways to communicate with our patients and with our physician colleagues so that we are all on the same page. I recently heard, as I was talking to the head of one of the research communities, after a presentation, a physician stood up and asked the question, how can I, as a physician, understand what you're dealing with, and how can I help to rule out the mouth as a serious focal point of infection? And what the physician was asking is, can you provide for me a clinical laboratory report that will help me understand what you are dealing with? And that's the reason for our opportunity that we have through Oral DNA Labs is to provide ways of communication again with our patients, which is primary importance, but also with our physician colleagues as well. So thank you, Dr. Osler.